Hi everybody, welcome to the Dr. Mom Show. It's Dr. D, mom of three. Thank you for joining me again tonight. Don't forget to subscribe to our channel. In addition, again, I hope you enjoyed our previous show. We had a tribute to colorectal cancer because March was colorectal cancer month. Today, I'm so excited. This is a special show for the ladies. Ladies, put your hands up. So today I'll be talking about what we call perimenopause and menopause. Yes. So even though this is for the ladies, fellas, it's also good to take a listen so you can kind of understand what your lady is going through and you can be supportive throughout it all. In addition, I just want to say happy Good Friday. I hope you're having a good day. Don't forget to go to church. So let's start off with some definitions. Menopause is when your menstrual period completely stops. Done. Premenopause, a lot of people feel is what we call before you go into menopause, but really that is the reproductive years. So that's when you have regular periods. The transitional period between premenopause and menopause is called perimenopause. Again, this is why we go to medical school and get loans to learn all these fancy terms. During this transitional period, this is when the menstrual cycle becomes irregular. Normally, this starts about 4 years before a female goes into menopause itself, and the average age is about 47. Now, the most common signs of perimenopause, like I mentioned, include irregular periods. What usually happens is normally a period will occur about once a month on average, but the time in between each menstrual cycle will start getting longer and longer. So maybe you'll have a period once every 2 months, or it may go to 6 weeks or 8 weeks. And this is due to the changes of hormones. Everybody loves that word, hormones. A next sign is you get decreased bleeding. So this just means you may have spotting or you may get lighter periods, but please note that some women experience heavier periods. So just keep that in mind if you're one of those patients where everything does the opposite than usual. Now next, I'll talk about some symptoms to expect in perimenopause. Of course, the beloved hot flashes. Bam, bam, bam. This happens to approximately 80% of women, and this is the most common symptom of perimenopause. Other symptoms include sleep disturbances, whether that being inability to fall asleep or wake up during your sleep cycle. A lot of times this can be exacerbated by these hot flashes because women will start getting what we call palpitations, where their hearts start racing, you're soaking wet. It almost feels like an anxiety attack or a panic attack. This can also lead to women becoming anxious. Sometimes women can even get depressed during this period of time because they aren't able to sleep well, or sometimes not even function like they usually do with these hot flashes because they just aren't comfortable. Other symptoms include vaginal dryness. Due to the decrease of estrogen during this time frame, the skin in that area starts to become thin. So a lot of women can, again, experience dryness, itchiness, sometimes even pain. A lot of times this can lead to sexual dysfunction. So because there's a decrease in natural lubrication, it can be painful to have any sexual activity, and again, then your poor lady doesn't want to do anything. So guys, get out there and get some lubricant to help your lady when they're going through this phase. So be supportive. The other thing is difficulty concentrating. Again, hot flashes, not feeling well. Some people just can't focus, and some women will experience joint pain. Now, after all of this, you go into menopause, and menopause is defined as when a woman has 12 consecutive months, so pretty much a year, of no period, and this is what we call amenorrhea. Again, this is a fancy word. The average age that this occurs at is 51. Once you meet this criteria, you're considered postmenopausal. Now, it seems like this is a horrible transition, and from some of the women I've seen, that sounds about right, because you unfortunately have to have all these symptoms. So with that, let's take a little break and let's show you what Alina thinks about perimenopausal symptoms. Take a look. I hope you enjoyed that. So see, even baby girl Alina understands this, even at such a young age. As women, we understand. Now, as far as the diagnosis itself of perimenopause or the transitional period into menopause, usually this is a clinical diagnosis. We base it off of the symptoms that a patient presents with. Also, if somebody presents and they haven't had their period for a year, again, we try to figure out when that final menstrual period was, so we can decide if that patient really has gone through menopause and is truly postmenopausal. Just keep in mind, some physicians may order some hormone levels. In addition, if your physician feels like something else is going on and it may not necessarily be true perimenopausal symptoms, they may also check some other blood tests like thyroid and things like that. So again, just make sure you tell your physician everything that's going on and all the symptoms that you're having. So there you have it. For those of you who are, now you know, premenopausal, you're in the reproductive phase with regular periods. For those of you who are going through the perimenopausal stage, I'm sorry, and again, you saw how Alina feels about it, but there is, as you can tell, light at the end of the tunnel. And for those of you who are postmenopausal, shout out to you because you made it. So the fact for today is, no one told me that as an adult I still need to get shots. Yes, that's right. As an adult, you still need to get shots. One of the most common shots you need to get is a Tdap shot. That's the tetanus with the whooping cough shot. Please make sure you talk to your physician about that. Normally, it is recommended that you get that shot every 10 years to protect yourself. Again, don't forget to wash your hands, kiss your kids, love your family, and say your prayers. Thank you and happy Easter. Bye-bye.